Hi everyone, if you have a degenerative disc, you should watch this because she has a degenerative disc at L5S1. That's the very bottom disc in the lower back, L5S1. It's the most common disc to have herniated, damaged, injured, or degenerated, okay? Degenerative disc is a disc that loses all of its material in the middle. Not only nucleus pulposus, but water. There's a lot of water and fluid in the disc. So when it degenerates, it thins. And when it thins, you're more susceptible to a pinched nerve, like sciatica. We all know what sciatica is: pain down the leg, numbness in the toes. So it doesn't just have to be pain, it could be numbness, tingling, it could be a burning sensation. But nevertheless, if you have a degenerative disc, you are more susceptible to sciatica or some kind of neuropathy or pinched nerve. So just be careful and stop lifting heavy stuff, especially if you're lifting it improperly. Bend at the knees, always bend at the knees. So we have Priscilla here, and we're going to show you how we treat a degenerative disc. So, as I said, she's got a degenerative disc here at L5S1. She finds this Cox flexion distraction technique extremely effective for this degenerative disc. We adjust her as well, and traditional chiropractic adjustments help, but this actually helps with the pumping action that we're going to do. It actually helps to pump nutrients into the disc. Will it make her disc big and fat like it was when she was a teenager? No. But it will help to repair and pour nutrients into that disc. Okay, so we're going to show you how it's done. So we've got her strapped in here. We don't strap people in right away on their first visit because, we have to tolerance test people first. But what I'm doing right here is she's got all these really tight muscles. And if you have back pain or a degenerative disc, you know what I'm talking about. The muscles right along the side of the spine, it could be left, right, it could be both sides, are going to be really, really tight and inflamed, and in some cases tender, sore. Is this tender here for you? Yes? Okay. So we're just going to get into these muscles here, and to get a little more specific, she has trigger points and some soft tissue damage here, muscle tension, muscle spasms at the quadratus lumborum muscle, the multifidus muscle, and iliocostalis muscles specifically. And these muscles really tighten up on her because she works with people. She's on the computer all day, so she sits all day, which just compresses that disc even more. And at the end of this video, I'm going to show you guys a product that I really like for people with degenerative disc disease, and for those of you that have to sit all day for work and have a degenerative disc. So I'll show you that little wedge. It's called a sacral wedge, but it's a really great tool that takes pressure off of that bottom disc and that sciatic nerve if you have sciatica. Luckily with Priscilla here, she hasn't had sciatica. We've been able to just make sure that doesn't occur in her case of degenerative disc disease. Oftentimes though, people do get sciatica. She came to us before she developed sciatica and numbness in the legs. So we've been seeing her on and off now for about, 5 years now? Yep. 5 years, going on 6 now almost, and no sciatica, no radiculopathy, no numbness in the feet or toes. And if you look at her disc on an x-ray, it's, on a scale of 1 to 10, I would say 10 being the worst, meaning the disc is almost fused together, meaning there's barely even a disc there. I would give hers like an 8. So it's not good. So I just loosened up that right side. Now we're going to loosen up the left side here, and I'm going to try to move out of the way so you guys can see. I do a mixture of myofascial work, trigger point therapy, Sometimes I do ART, which is active release technique. There are a lot of different myofascial techniques, and they all work. Some work better for others, but they all work. And we also use instrument-assisted soft tissue mobilization, so like Graston technique. And she does well with trigger point therapy and myofascial work. And then we have a PTLMS machine, that loud machine you guys have probably seen us use before, that uses vibration. But tons of research showing that myofascial work is extremely effective for lower back pain and neck pain as well. How are we doing so far? Good. Okay, now that we loosened up the soft tissue around the lumbar spine, we're going to go ahead and do some Cox flexion distraction technique. And with her, because her disc is only damaged or injured at the very, very bottom, you see I'm starting my hand up higher. I'm going to work my way down all the way to that bottom disc and place my hand just slightly above that disc. So her disc is degenerative between L5 vertebra and her sacrum. So I'm going to place my hand right at L5. So the disc is underneath the L5 vertebra, and we're going to open up that space and pump some nutrients into that disc, open up the facet joints, and open up the space where the nerve exits. Even though she doesn't have a pinched nerve per se, just degenerative disc disease, we want to make sure she never develops a pinched nerve. And this is a great technique, the gold standard when it comes to treating degenerative disc disease. And right here you probably feel a good strong stretch. And folks, you guys are watching this, you're like, how could she feel a strong stretch? All I'm doing is moving this table down, right? You'd be surprised. Okay, when I place my hand here, that changes everything. And this is a much more intense stretch to the lower back than many of you are probably perceiving watching this video. And right here we have the hand at L5. Okay, now we're going to take the table out and stretch her out and do the flexion distraction. So I'm just going to step on this little strip here. You can see how this table extends this way. So we're going to do that while we do the flexion distraction. Now, when Priscilla doesn't see me for a while, for, months, oftentimes when we do this, she gets a little sore. So I go a little bit easy on her, not try to do too much, especially because she's not in a ton of pain. This is more of a maintenance visit for her. She hasn't been in a few months, and she felt tightness in her back and stiffness. And she's smart. She comes in when she has tightness, when she has stiffness, when the back gives her the warning signs that something is going on, that something's amiss, something isn't right. That's when she comes in, not when she's doubled over in pain, can't get out of bed, can barely walk and stand on her feet. That's not the time to go in for your you should go to your chiropractor if that's happening, but typically there were many other warning signs prior to you waking up so debilitated. So listen to those warning signs. Listen to your back when it tightens up or when it gets stiff, especially if it's stiff for more than a week. Okay, if it loosens up with stretching and exercising, great. But if it's still stiff a week later, you need to go get that addressed, even if it's slight discomfort. Okay? And okay. Now, she has a lot of fixations here in her thoracic spine. We're going to get some more mobility there in the thoracic spine here in just a second. Okay, go ahead, take a deep breath in and blow out. You okay? Okay, and take another deep breath in. Good, and blow all the way out. Okay, turn over on your back. And if you could put your mask on for me. Great, thank you. So there you guys have it. You saw how we treat the lower back, a degenerative disc. It's much more intense than what it looked like there, but it's extremely effective. If you are looking for a Cox Technique certified doctor, go onto the website, and not my website, but Cox Technique website, spelled with a C at the end of technique, not a Q-U-E, but a C. And you'll see on the website there a place where you can put in your zip code and try to find a certified Cox Flexion Distraction Technique doctor. And if you're just waiting for those loud cracks, people, her neck is loud. So let's see. I know there's some of you out there that love to hear those loud cracks, and that's a byproduct of the adjustment, but here it is for you folks. That was loud. Okay. And one more here. All right, relax there. Let that adjustment settle in. And you guys, thanks for tuning in. We really appreciate you. Thanks for watching. If you have any videos or ideas, or you want to see something, comment below. We'd be happy to try to make a video for you on that particular condition or subject. So again, thanks for tuning in. Thanks for the thumbs up. And thanks for subscribing. See you soon.